Welcome. Thank you so much for being here, both in person and online. We're grateful you could take the time to celebrate International Pathology Day with us. My name's Sophie Scott. For those of you I haven't met, I was the medical reporter for ABC. I also want to acknowledge my former colleague, Gabby Rogers from Channel 9 here is covering this event, which we're very excited about. And thank you to the college for inviting me back to be with you today. Before we get underway, I wanted to acknowledge the traditional owners on the land we're meeting, the Gadigal people of the Eora Nation, and pay my respects to elders past and present, and also to acknowledge any Indigenous guests that might be joining us in the room and also online. So the college started, it was called Pathology Day, and then it became International Pathology Day, and it's actually now celebrated in more than 10 countries around the world, including Hong Kong, Malaysia, the US, the UK, Canada and South Africa, so it's really become a big deal. I think the college deserves a bit of a round of applause for starting this movement to celebrate pathologists. So I just have a little bit of housekeeping before we get underway. If everyone can just grab out their phones and pop them on silent for me. And while you're there, if you're on social media, we would love you to follow the college. If you're on Twitter or X or whatever the hell it's called these days, the college's handle there is Pathology RCPA. So if you want to go there and follow them. And if you're on Instagram, which is where I spend most of my time these days, you can follow the college. They've got the handle of _RCPA, and mine on Instagram is Sophie Scott and the number 2. So, and there's a couple of hashtags that we'll share as well. So if you're on socials, you'll see the hashtag, it's RCPA and IPD23 and a whole lot of other ones. I'd like to welcome our fellows that are joining us from overseas. We've got people watching from around Australia, New Zealand, Hong Kong, Singapore and Malaysia. So welcome to our online audience as well. So today we're going to be talking about a very important topic that yet again underscores the importance of pathology. Chronic traumatic encephalopathy, which thankfully has a shortening of CTE, so we don't have to keep saying that over and over, and its links to contact sports. And like so many other conditions, without pathologists and pathology, we wouldn't have a diagnosis for this condition. And, you know, everyone in this room and watching online knows that pathologists and the vital work that they do is often under-recognised by the community. But with CTE and the pathologists that you'll meet today, you'll see that pathology is really taking centre stage in this debate in CTE. And the pathology community has shown itself to be innovative and not afraid to speak out, as you'll hear with this new position statement. And I want to thank the story in the Sydney Morning Herald was a really great explanation of the really important points of that position statement. And it's the strength and resilience of pathologists not being afraid to speak out on topics like this that we really celebrate today with International Pathology Day. So I'm going to be up on here interviewing the experts, but we want your questions as well, particularly in the room. So be thinking about if you've got any questions for our experts and our patient advocates, you'll have a chance in the panel discussion to ask questions. So be thinking about what you'd like to ask these amazing experts. So I'd now like to introduce the Chief Executive Officer of the Royal College of Pathologists Australasia, Dr. Deborah Graves, OAM. Give Deb a big round of applause.
Thank you so much, Sophie, for a lovely introduction. And thank you so much for coming here today. Happy International Pathology Day. We're absolutely delighted to actually see so many people in the audience today and online. It's a very special day for the college because we want to celebrate the importance of pathology and the value it provides to the community in relation to diagnosing cancers, the genetic testing, all the COVID testing that was performed during the pandemic, issues in relation to blood transfusion, and also the very, very important topic that we're going to be talking today in relation to autopsy pathology and CTE. I think pathology is often, the pathology and pathologists are people don't get a lot of recognition really in life because they're often behind the scenes. You often hear the surgeon the surgeon's diagnosed this. No, it's the pathologist that's diagnosed the cancer. I'm sorry, surgeons. But also it's something that we really want to get out there that our 3,000 fellows and 700 trainees across Australia, New Zealand, Hong Kong, Singapore and Malaysia and all the other pathologists around the world provide an amazing service to people to make sure healthcare is delivered in an appropriate way. And we are at the forefront of research in areas like CTE, and I think this today will underpin that importance even more. It's such an important and difficult condition to talk about, but we've got a wonderful panel here today. We've got Dr. Michael Buckland, who's a neuropathologist, Linda Iles, a forensic pathologist, Renee Tuck and Amanda Green, who are relatives of people who have suffered from this disease. And I think it's a testament to the drive, I think, of our pathologists to actually assist in this, but also for the families to come and share their stories with us today, to make it such a personal issue. The college felt so compelled by Michael's concerns, and we took it to all of our advisory committee, anatomical and forensic advisory committee, and there was overwhelming support to develop a position statement on this issue to try to actually ensure that we get some action. The Senate inquiry was a very important initiative, but we would like to see some action coming out of that Senate inquiry. So we're going to be sort of talking about that today and hopefully be able to assist to get some action going forward. So I'd just like to have a good time. It's going to be a great session, I think. We've got fabulous speakers, and I'd like to give a special welcome to the families here, and we've got some people online as well today, so it's very important, and we'll be back a bit later.
Thank you. Now I'm going to move over here. I'd like to introduce one of the leading lights in the CTE debate. Associate Professor Michael Buckland is a senior staff specialist, the head of the Department of Neuropathology at RPA, and he's the founder and director of the Australian Sports Brain Bank and the head of molecular neuropathology at the Brain and Mind Centre. Ooh, that's a big resume. There you go. Come on, Michael, come on up. Give him a round of applause, everyone. You've got a very knowledgeable audience here, but I just really wanted you to give us briefly what is CTE, what the causes are, just for those who may not be 100% across it.
Yes, so CTE, or chronic traumatic encephalopathy, it's a degenerative brain disease. It's not that dissimilar to Alzheimer's disease in how it looks in the brain under the microscope. The difference between Alzheimer's disease and CTE is that CTE, we know the cause of CTE in almost all cases, which is exposure to repeated head impacts. Often CTE will manifest itself in someone after they've retired from an activity such as contact sports, often has an insidious onset. In younger people, it's often reported to be associated with mood or behavioural problems, anxiety, depression, irritability, aggression, drug and alcohol abuse, suicidal thoughts and actions. But certainly in the younger people, it's got very much a mental health flavour to what they're going through. Sometimes it doesn't manifest till someone's a lot older, and then it often looks a lot like Alzheimer's disease in the way that person has trouble with their thinking and their memory. But often still there is also a stronger behavioural component as well. So we've actually known about CTE for almost 100 years. And for the vast majority of that time, it was thought to be a disease pretty much restricted to boxes. And certainly when I was a medical student, I learnt about CTE way back when. It was called dementia pugilistica back then. But it's very much presented to us as something that was almost a historical oddity, something that was restricted to boxes, particularly in the good old days when you'd have jobbing boxers going around and doing lots of bouts at local fairs and so forth. And so for most of my professional career as a doctor and then as a pathologist, I actually carried that idea in my mind that CTE is a disease incredibly rare, seen in some boxes. So I actually never really looked for it until I started to see the literature coming out of the US, where they had described CTE in some American football players. And as I followed that literature, I realised that I see a lot of brains. That's my whole job, is examining, making diagnosis and classification of neurological disease through examination of neurological tissue. So I see a large number of brains, not only for coronial purposes, but for hospital autopsies, people with suspected Creutzfeldt-Jakob disease. I see lots of weird and wonderful stuff, but I'd never seen that pathology they'd been describing in those ex-American football players. And it was remarkable and also disturbing that the first time I actually got to look at the brain of an ex-professional rugby player, it was riddled with CTE. And really from that moment on, I knew that there was a disease here in Australia, a brain disease that we had not recognised and was flying under the radar. So I don't think it's a new disease. I actually think it's a disease that's been around all the time. It's just we've been missing it because we didn't understand what to look for. But now we do. And so at the moment, we can only diagnose it confidently by examining the brain at autopsy. Hopefully that will change in the future, because once we're able to diagnose CTE during life, we can look for ways to manage it and treat it.
And we mentioned earlier, and we're going to be talking a bit today about the position statement that the college has put out. Why is it so important that the college and pathologists like you take action on this matter so that you raise it as a public health issue?
Yeah, that's a good question. I guess because at this stage, the diagnosis of the disease falls squarely in the realm of pathology, and our understanding of the disease has emerged from pathology studies. So it's very much, it falls within the remit of pathology, and I was delighted when the college got in contact with me and said they wanted to do this position statement. It was not something I'd been pushing for, but in fact it was the college initiated this position statement. But I was just so pleased because I think that such a respected medical college in Australasia making a position statement like this is a very, very powerful statement.
And pathologists, like you said, they're a respected group in the community. You're obviously doing a lot of work in this space, but you've also got an audience of pathologists here and online watching. What would you say to other pathologists or as a group what you need to be doing to keep this in the public spotlight, to keep the focus on this so it doesn't just fade away and another sort of topic takes prominence, given it's something you're so passionate about?
Yes, well, I guess it would be good for all pathologists to read the scientific literature about it. I would encourage them to read the literature from independent researchers and independent doctors rather than ones funded by sporting organisations. And I think just get up to speed with what the pathology looks like. And if you are a forensic pathologist or someone that does do autopsy pathology, understand how to examine a brain to look for it. Because I think the more people, the more minds we bring to this problem, the faster we'll get answers.
And one of the things, we can talk about this a bit further as well, but one of the things in the position statement was the impact, and you talked about this in your TED talk. Michael and I actually met, we gave a TED talk on the same day. So that's how we met. And his TED talk, if you haven't watched it, it's about CTE. You really should watch it. It's fascinating. And the main message from your TED talk is really that, we all have a responsibility, and particularly if you're a parent, we need to think about the exposure if your kids are playing contact sport, what impact that might have on them when it comes to a risk factor like CTE. So there are lots of parents in the audience. What would you say to parents about what they need to be thinking about if their kids are playing sport?
Look, it's, as I said, actually in the TED talk, when I published that first case of CTE, and I should acknowledge that Hayley Folks is in the audience, and it's only through her support that we've managed to get this far, so I'm very grateful to her and other family members. Obviously the Tucks and Amanda Green have been just absolutely rock solid. But when I first published that case, I was very naive, I think, because I thought everyone would say, oh, that's great, thank you very much for identifying this problem, we'll go and fix things. But I didn't actually get that response.
So you had pushed back on the fact, yes, you've identified the problem, and potential ways of dealing with it, but there wasn't necessarily the support of groups like sporting bodies to listen to what you were saying.
Yes, and I think, yes, and I've come to understand that it's because it's it's not just a medical problem, it's sort of a sociological problem as well, in that I mean, most people in the audience here would love sport and loves all the positive benefits that come out of playing sport. And many people, derive a lot of their identity through their sporting activities. Many families have, this sport is a central part of the weekend and how they socialise. So it may be interpreted as attacking sports, and that's certainly not what we want to do. It's as the college has said in their position statement, that it's really about just modifying the rules to make sure that we protect our children. And I think, if any parent out there, if they heard that there may be safety concerns over a product that their child was using, I think
using every weekend.
Yes.
Not just using once, but using every weekend and maybe during the week as well in training.
Yes, they'd want to know, and they'd want guidance from respectable institutions such as the RCPA. So I really applaud them for making such a strong and appropriate statement, I think, as they have today.
Just before we move away from parents and kids, are there? I might just get you to explain. It's a dose-dependent relationship, isn't it, in terms of the exposure and the amount of exposure. So I think you were saying in the TED talk, you're not saying to parents your children shouldn't play sport, but you should be thinking about, whether the amount they play and the number of times they might have potential knocks to the head. So just thinking about how often they're exposed to that.
Yes, it's really important to understand that CTE doesn't seem to be an issue associated with concussion. It's an issue that is associated with repeated non-concussive blows. So the blows that either to the head or even to the body with force transmitted up to the brain. It's those sorts of blows that you feel fine afterwards. You keep going, and you would probably get hundreds of these during a junior sporting season. And it's that cumulative effect of those multiple small blows that lead to later in life neurodegeneration.
I think that's a good point. I might just get you to clarify that, because a lot of the sporting codes might say, well, we've got concussion policies, we've put a concussion policy in place, but what you're saying with CTE, it's not about concussion. It's about these things that happen a lot more often.
Yes.
That can be just blows, and the player is not necessarily not concussed.
That's right. And I think, I don't think anyone would be surprised if I told them that when I was younger I used to love jogging, and now I'm older, I've got a gammy knee. I never actually injured my knee. I was never on crutches or anything like that. But everyone can understand that, hang on, this repeated exposure to minor impacts sets up something that later in life declares itself. And certainly we don't want to downplay the importance of good concussion management. And concussion is a serious issue in and of itself, but it's not the same issue as CTE.
Fascinating. So Michael's coming back in a few minutes after I interview our next speaker, and then also for the panel discussion. So if you've got any questions, keep them in front of your mind, and you'll have a chance to ask him some questions in the panel discussion. But for the meantime, give him a big round of applause. Thank you, Michael. There's so much we could ask him, but we've got a chance to ask him some more questions soon. I'd now like to introduce our next speaker. Associate Professor Linda Iles is the Head of Forensic Pathology at the Victorian Institute of Forensic Medicine, and she coordinates the Institute's neuropathology service. And due to that organisation's partnership with the Australian Sports Brain Bank, Professor Iles facilitates the management of the deceased person that might have suffered CTE. So she's got a really crucial role. I thought we might, just given your background and welcome, first of all, can you just speak to the audience about the importance of medical autopsy?
Certainly, thanks, Sophie. Yes, I guess outside of the forensic setting, the medical autopsy has multiple facets in terms of value, from a quality assurance point of view when it comes to new medical products, for example, or to affirm, the appropriateness of clinical decision making. Also probably first and foremost, to provide information to families and give them sort of clear explanations as to what might have happened to their loved ones. And beyond that, in terms of potentially heritable diseases that might have an impact on surviving family members that might be treatable, that we can get in early from, so avoid the outcomes for the decedents. And I guess from a research point of view, particularly rapid autopsy programs, for example, the Cascade program that's running in Victorian, I think in New South Wales as well now, in terms of access to rapid tumour tissue for research purposes, and also diffuse midline gliomas in children, for example. And then from a public health perspective, and I guess that's what we're looking at here, I might give an example. Towards the end of 2021, third wave of COVID, there were, both in New South Wales and Victoria, large numbers of relatively young people dying at home from COVID, or us determining that they died from COVID. And the questions that clinicians were asking us is, why are these people dying at home? They're relatively young, they shouldn't be. And so from autopsying those decedents, we could pass on information to clinicians, which actually really helped them in terms of how they manage patients with COVID. And then there's obviously CTE in terms of a significant public health issue.
And so when I spoke to you in preparing for today, a question I asked that I thought was fascinating, your answer. When you look at a brain with CTE under a microscope, what do you see? Can you tell us what you told me? If you're just doing the standard test that a pathologist would do, what do you see?
Well, if we take a step back, from a macroscopic point of view, a gross point of view, unless someone has very, very advanced CTE, the brain looks normal. So that's the reason why pathology is so important. In advanced CTE, you might have atrophic changes, but again, they're not specific to CTE at all. As you can see in lots of neurodegenerative conditions. And so particularly in early stage CTE, even under the microscope, unless you do the extensive sampling and the appropriate immunostaining, it will look normal. And so that is why pathology is at the forefront of the diagnosis of this condition. But it's not straightforward to diagnose. And even in a routine autopsy where the brain is examined, we would take 6 blocks, for example. And that is really insufficient, particularly for very early stage CTE. You're unlikely to pick it up. So the extensive sampling required to diagnose particularly early stage CTE, requires a much more intensive examination, which is why having information prior to the autopsy and prior to the brain examination is really crucial to make sure we do the appropriate investigation.
So that was so interesting. So it's not something that can just be picked up sort of routinely. You really need to know and look for it to find it. And if someone dies and the family suspects CTE, you mentioned that there are a number of options the family can go down.
Yes, so I work in the coronial setting, and we do partner with the Australian Sports Brain Bank in terms of donations, so families and decedents who've pledged their brain prior to they die. So that's one arm of, I guess, our contribution to CTE research. But the other aspect is, I guess, from an acute diagnostic point of view, and that is almost majority of cases occur when people die from suicide. And now with modern forensic practice, a significant proportion of suicide deaths by suicide, the cause of death is evident, and there is kind of no mystery in terms of how the person has died. And now that we have modern imaging techniques, a number of these cases will not proceed to autopsy. And so it is really important for us to know if there are concerns around repeated head trauma and CTE, so that we can do the appropriate investigation. So that's not only just autopsy with brain examination, but it's autopsy with the extensive brain examination required for CTE. And so that can be difficult for families. Not everyone is comfortable with autopsy, and that's what we need in terms to diagnose CTE. Without the autopsy information, we just can't. And I am aware of families who have raised a concern for CTE, but they can't take that next step of saying, they can't take the next step. And that is absolutely fair enough. It's such a difficult time for families, and it's such a difficult decision to make. But for families who would like brain examination pursued, we have a couple of options to sort of suit their level of comfort. So on one end, they will agree to retaining the brain and sending it up to Sydney to the ASBB and donating that brain to research. Not every family is comfortable with that, so we've developed some sort of middle options in terms of sampling that we can do in Melbourne. So we'll just send the extensive sections up and the photographic images up to Michael so that he can make the diagnosis there. So, you know, we can talk to families about what they're comfortable with so that we can get the best diagnostic outcome for them.
And obviously there's more and more public awareness now of CTE, but why is that so important? Why is it so important that the public and families know about CTE in case something might end up happening to their family member?
Absolutely. So we really, as I said, the brain examination to diagnose CTE is complicated, significantly more complicated than a routine brain examination. So we really need to know that beforehand. And look, I have to say, from my experience over the past few years, particularly given the advocacy of families that are here today, the Frawley family, Amanda Green, who I just met for the first time this morning, that has really made a significant impact in terms of families reporting their concerns or reporting that their loved one has had a lot of issues with contact sports and head injuries in the past, and that has allowed us to triage those cases appropriately. In fact, we've even had police officers who said, I know this fellow, you know, played a lot of country football, and so we're concerned about CTE. These are in suicide cases. So that advocacy has really translated into in helping us identify the cases that we need to go the extra mile to examine.
It sounds like because it is such an involved process, it's not something that could be done routinely. So we need that public awareness. We need that so that families can be sort of thinking, oh, you know, maybe it could be CTE given the history of playing contact sport. And what else would you like this audience to know about from your perspective as a forensic pathologist? What are the key things you think this sort of pathology audience needs to take away from the discussion?
You know, autopsy, the decision for autopsies is really difficult for families, and I absolutely appreciate that. But, you know, I just would like the audience to know how appreciative we are for families who are, it's not an easy decision to have an autopsy or have an extensive brain examination or even sort of donate the brain, but it is of such high value. And, you know, I just would like to thank the families who make that difficult decision because it's, particularly in this space, it's made a really valuable contribution to public health. And yes, I'd just like to reiterate my thanks to those families.
We're going to meet some of those families soon and some of the amazing people that have come forward to share their stories, and that's really been crucial in driving that awareness and having people, you know, doing a difficult task, which is sharing their family's story, but it's just so important so that the public knows what's going on. So we might just get Michael back up here. If you want to stay, Linda, we've just got a few minutes where we're going to just ask both of you questions. Give Linda a round of applause. There you go. Well done. We'll just stay with you for a minute, and then we're going to move on to our amazing family and patient advocates. I'm just keen, Michael, I asked Linda what you would like this audience of pathologists to take away, or what's the key things that you think you want the audience of pathologists to be thinking about when it comes to CTE, because it is quite a specialised and knowledgeable audience, probably, you know, more so than most people that you would speak to. A nice loud voice.
Yes, okay. So
pathologists, I've realised pathologists are usually very quietly spoken. So if I get invited back next year, we're going to do a little rehearsal and everyone's going to speak in a really loud voice.
Look, I think pathologists, particularly pathologists that look at tissue and do autopsies, everyone should know what CTE looks like and how to sample and test for it.
Why don't we just do a show of hands in the audience of pathologists? How many of you have actually seen CTE under a microscope that you would know what it looks like? Okay, we'll be sending around we better send around some slides as a follow-up to this talk. But that's a good indication that, yeah, maybe people haven't seen what it looks like.
Yes, well, we better
fix that.
We better fix that. And perhaps the college.
But that's why these events are so important, because we do have such a knowledgeable audience, and we want to, improve their knowledge too. So, because they're the ones that are going to be, flying the flag for this as a public health issue.
Very much so, and maybe the college. I'll give some slides to the college. They can put in the next exams for. But I guess.
So pathologists need to know what it looks like so that they can look for it.
And how to sample for it.
And how to sample for it, yes. Is that something that you need special training for?
Yes and no. I think most anatomical pathologists are very much trained in examination of organs and tissues. So it wouldn't take much to understand how to sample and look for CTE for anatomical pathologists or forensic pathologists, I think. So they should all, I think it would fall within their comfort zone. I guess the other, even on a broader scale, it's just important to realise as well that that there still are diseases out there and that are probably still flying under our radar. And so I think every pathologist needs to have an open mind and not just stay tunnel vision with what we know, but also be open to what we don't know. And I think Australian pathology has a great history of that, with the discovery of Helicobacter pylori and gastric ulcers. Again, just through a curious pathologist that was that made some observations. Yeah, that would be a much more fundamental.
And then went on to win the Nobel Prize for that curiosity.
Yes.
Yeah.
Yes.
So you never know where curiosity can lead you. It's a really good point to not just assume, and particularly when I was really fascinated what you were saying about what you were taught in medical school about this, and so those assumptions, to not just continue with those assumptions that you were taught in medical school, which clearly were outdated and wrong given what we know now about CTE.
Yes, they weren't. I'm pretty old, so they weren't outdated back then, but we do.
Well, I guess what it shows is our knowledge is always evolving, isn't it? Our knowledge is always changing, always evolving, and it's good to, I guess that's the nature of science, to question the assumptions, question what you've always believed, and to question whether it still holds. And this is a really good example in doing that, isn't it?
Yes, it is. Yes, and certainly I didn't know what I was getting myself into when I started, but it's been a very interesting journey, and it's been amazing to have such supportive colleagues like Linda, and such supportive families as well. So yeah, it's been
fantastic. We'll give them. Did you want to say something, Linda, and then we're going to move on?
Just in terms of the diagnosis. For example, I work in a forensic institution. We have, since we're speaking to people for pathologists here, and we have a small capacity to do immunohistochemistry, but we have specifically got in the tau antibody for these types of cases. But I use that. If it's negative, I won't send a case to Michael, but if it's positive, I'm going to send it to him, because I actually think it's really important to get the diagnosis right. And so therefore, sending it to a centre of excellence and expertise is actually really important, because I think, obviously there are other tau-related pathologies that you don't want to misinterpret for CTE. So that's why I think it's really important that when you have a centre of excellence that you might be comfortable making the diagnosis yourself, but I also think a second opinion from someone who
sees a lot of it, sees it day in and day out.
Really important.
That's a good point. All right, give our experts a big round of applause. They'll be back. So thank you both, Michael and Linda, for that insight. And as I said, you will have the chance to ask them questions when we do the panel discussion. But as both Linda and Michael mentioned, this issue of CTE wouldn't have received the prominence that it has in the media without amazing families speaking out about what happened to their loved ones with CTE. And we're going to hear from two family members now. First of all, we're going to invite Renee Tuck to come up. So Renee give Renee a big round of applause. You want to grab that?
Wherever you're comfortable. I'm not a pathologist, I'm very loud.
So I won't need to tell you to speak up.
I want to do this gently.
So let me tell you a bit about Renee. She's the sister of the late Richmond player Shane Tuck, And as you'll hear, she's got direct lived experience about how CTE impacts families. After taking his own life in 2020, following a long battle with mental ill health, Shane was found to have suffered from severe CTE during a brain autopsy. And as you'll hear from Renee, this diagnosis really gave the family answers and helped the family rebuild their lives. And Renee is really passionate about helping other families going through the same thing. Shane was an AFL player who played 173 matches for Richmond, and he was only 38 when he took his own life in July 2020. So give Renee another round of applause for being here and speaking out.
Haven't even done anything yet. That's great. Thank you.
Look, it's being here, just being here is good. So why is it so important for you to talk about CTE to this audience and other audiences?
I think firstly, I have to say thank you for having us. It is an honour to be here with all of you amazing people that have helped our healing journey and our futures be a little bit easier. So I think the reason why I need to be a voice, yes, we're left behind without Shane. Shane's the one that did the hard yards. He really went through absolute hell, and I can say that wholeheartedly. We didn't even know that there was such a thing. It was more of an American football player thing that I'd never heard of. Apparently there's that movie Concussion. There are these little bits and bobs around, but we were fighting a disease we had no idea existed. So he was dying before our eyes and we had no idea. We were literally ripping our hair out. He was hearing voices. He was presenting very mentally ill. He tried every medication under the sun, needles, hospital visits, 2 previous suicide attempts. And that was over a span of about 18 months before he was successful, one might say. It is my duty, for the love of my brother and humanity, to get out there and support you geniuses in how you've helped us understand his pain. Because while we watched it and we saw him break and we couldn't do anything about it, we now understand why he had to choose his peace, if that makes sense. And that, sorry to cut you off there, but I know a lot of people that lose someone to suicide don't have that, they don't have that answer, and we received that. And I can't thank you all enough. You'll never get onto the forefront with us people most of the time. You are in your labs doing what you're doing. What you have done for my family and his children to go forward and know that there is a diagnosis as to why he left. His daughter was absolutely just traumatised, thinking he'd just left, and he didn't. So if I can voice anything here today, it is to thank you for giving us a future where we can move forward knowing that there was a reason and there was pain, and that is no longer for him, I guess. And I don't want anyone else going through that.
Yeah, and I was going to say, so it sounds like getting that diagnosis must have made a lot of things would have started to make sense for you, given what he had been through.
Unbelievably so. It was like you just couldn't put your finger on it. I don't know how to explain it in a medical term. A bit out of my depths there, but he presented with his voices, and the doctors tried schizophrenia, but it wasn't that. The meds wouldn't work for that. He wasn't depressed. He was a go-getter in life. Everything he did was 110%, whereas Travis and myself, my other brother, we go, oh, dip the water. Oh, it's a bit cold. I don't know if I'm going to swim, whereas Shane's already ripped his gear off and he's at the end of the pool. Like, he just went hammer and tong at life. So we knew it wasn't mental illness, and we sure as hell knew that if it was, those meds would be doing something. And he was declining and declining, and he started seizing up with his motor skills, and it just sort of... because it was the first lockdown, he couldn't see his family. He'd come home to be looked after by my mum and dad, and Kat was raising the kids in Adelaide. He couldn't get back to see the kids. COVID went mad, everyone got scared, no one went anywhere, and then July 2020 was when I think he'd just had enough.
And we've got, a room full of really influential medical experts in pathologists.
Yeah, not intimidated at all.
What should pathologists do, though, to use their influence to so that we can see some change and so that other families don't have to go through what you
couldn't even say that you're not doing it right now. I must say, though, for everyone's knowledge, Linda worked on Shane and took his donation in Melbourne at the coroner's court. What do you call it? Just coroners, yep. And then Michael then worked on Shane. And to us, that's a part of our loved one. That's not just his brain, that's him and what he can help give to others. And both Linda and I, first time meeting today, but have been in contact in the past. Michael gave his phone number out straight up to my parents. There was no call my assistant, we'll get an email and we'll do. This is big stuff. And families are absolutely broken by the time they've lost their loved one. To have that warmth and understanding and the passion that you all have for what you do, which is A, why you're there, and B, to help us, humans who are in a really yucky, dark, grieving place. I couldn't say you need to do any more. Like, what you're doing is phenomenal. If we didn't have that diagnosis, our lives would be very different.
And we've obviously got amazing pathologists like Michael and Linda sort of leading the charge on this, but how important is it that we have other pathologists, and I know that as a number of pathology students and medical students are joining today, which is fantastic, and watching today. How important is it that we encourage, other younger pathologists to continue working on this and to make this something they're interested in as well, so we continue that advocacy?
I think change, if we all work together, I can be a voice, a very loud one at times. You gurus can do the science stuff. And we work together to bring forth CTE, which is what we're here and about, because it ain't going anywhere. It is not going anywhere. I'm tipping there's been a lot of footballers in the last 20 years that have been buried with those brains. And hats off to my mum, who was the one that said, we need some answers. This is going to be the hardest thing I've ever done as a mother. But if I can speak to you as a young person who's doing your science and loving it, all I can tell you is don't stop, because you're not saving lives per se on the brains or whatever you're studying. You're saving our lives and our future and the future of Will and Ava, Shane's children, and that's just one family. So you can go as far as you want with saving lives and people and our mental health, really.
Yeah. So it's, I don't know,
does that make sense?
Yes.
Yeah, cool.
It sounds like it's obviously been something that you're very passionate about, and you're really committed to spreading the message. Yep. And
only because he just did the hard yards. So, I know people say, it is emotionally draining to discuss, but there's just no way Shane's story needs to be forgotten or in vain, I guess.
And so just wrapping up, what would you like this audience to take away from your perspective and what you know now about the role of pathologists in particular in diagnosing this condition?
Can you put that in my terms?
I guess we've got a room full of medical experts who all have a voice. Yep. So anything they can do, they can go back to their own networks and tell someone about CTE. Yep. Talk to them about this event today. Say, get these slides that we're going to send out to everyone and look at them and understand what it looks for. Like, what would you like everyone to do?
Stand your ground. Have faith in what you do. Believe in what you do, and bloody go for it. Because this is big stuff and it's going to be big in the future, and you're changing lives. Go for it. On the days you feel absolutely beaten and like you're hitting a brick wall, call me.
I've got a number.
Honestly, I'll razz you right up. Yeah. Because we'd be lost without you.
As a coach, she's amazing.
No, honestly, I can't say it enough. And I look at my parents here today and how far they've come. Dad found Shane. That can't be something that you shake out of your memory too well. We drink a bit of beer. We try, don't we, Nick? But nah. So, yes, while it was a horrendous time, I hope that, if anything, today you can go forth and really, truly believe in what you do, and don't let anyone steer you anywhere but where you want to head.
Give Renee a big round of applause. She's amazing. Thank you. Thank you. Now, Renee will be back. She'll be back when we do the panel discussion. So if you had any questions that you were dying to ask Renee, you'll have a chance when we do the panel discussion soon. But I now want to introduce our next patient advocate. We've got Amanda Green. She's also campaigning to raise awareness of CTE after her husband, NRL legend Paul Green, was found to have a severe form of the disease. And again, Paul was only 49 when he took his own life in 2022, so this is all quite recent. After his brain was donated to the Australian Sports Brain Bank, this definitive diagnosis really brought some closure to Paul's family, and Amanda's, again, also shining a light on this diagnosis so that we can really advance detection and education. As everyone, knows who's an NRL supporter, Paul Green was an NRL legend. He played for 5 different rugby league clubs, 7 Origin matches, and then moved into coaching. So give Amanda a big round of applause for being here. Thank you. I might just get you to tell what we spoke about, how you came into contact with Michael Buckland and how the whole thing happened with your husband.
Sure. I must admit the days around losing Paul are still a bit hazy, obviously, but my understanding is that Professor Buckland got in contact with the coroner. The coroner then got in contact with Paul's sister Lisa, who I had put down as my point of contact. Then Lisa connected myself and Professor Buckland. So if Professor Buckland had not reached out to the coroner, I honestly do not know where we'd be today. You absolutely changed our life reaching out. Thank you.
And can you just take us through what happened when you got that diagnosis, when you actually found out that it was CTE?
I suppose it was a sense of relief. What happened that day was so left field. It was so out of the blue. Yes, I had seen some changes in Paul, but yeah, I just couldn't get my head around what happened. Every time I looked at my kids, it just absolutely broke my heart. So to receive that diagnosis, I suppose, was a sense of relief. I could get my head around and understand what had happened and what Paul had been going through.
Because you were saying he'd started coaching and you thought maybe coaching was too stressful or he wasn't coping, but now it sounds like when you got that diagnosis that things started to sort of make sense for you a lot more.
Yeah, absolutely. Once I got that diagnosis, I suppose I could look back and I could see that there were changes in Paul. I had noticed changes in Paul.
Behaviour or?
Yeah, his changes were mainly behavioural changes. He had lost his spark and he just wasn't handling situations like he had in the past. But like you said, I'd put that down to that high pressure environment he worked in, a highly stressful job. I thought it was a job that was slowly taking him away from us. I can now look back and understand that he was suffering a brain disease. We just didn't understand it at the time. And
one thing that the college is calling for in the position statement is the issue of children playing sport. And can you talk from your point of view as an advocate for awareness about CTE, but also as a parent, how challenging is it to sort of navigate that issue?
This one's a big one for me. I battle with it every day. I've got 2 kids who live and breathe sport. It's their everything. It's their social life. It brings them confidence. It means so much for them. So for me, it's about all working together to ensure that the environment that they play their chosen sport in is as safe as possible, and they're not doing harm to their future health. It's a big one.
And is it really important that it's not just sort of parents having to advocate, but it's also schools thinking about this, being proactive and thinking about making sure it's a safe environment for kids to play sport?
Absolutely. As a parent, I now that I understand CTE, it's really tough to watch my kids play their chosen sport. So it's not as easy as just pulling the kid out of the sport.
No.
There's so much more that goes into it. So it's really important that we all work together to, like I said, make this environment as safe as possible.
And do you think that should be the same for, I mean, how important is it that the sporting codes are the same as well, that they also take this seriously as well?
Oh, absolutely. Like I said, we all need to work together to ensure the long-term health of our next generation of budding athletes.
And I've asked some of the other people this, but I'll ask you as well. We've got an audience both here and online of pathologists. What do you really want them to know and to take away from your experience?
I suppose just to know that the research they're doing is absolutely imperative for the health of our next generation to continue to drive change. So, yeah, we are looking after our next generation.
And, you know, we've heard from Michael Buckland and Linda, and that they're, you know, the leading lights on this. But how important is it that we have other pathologists supporting them and other, you know, younger pathologists coming up and while they're studying, taking on this issue as something that they're passionate about, because we know that there are strength in numbers when it comes to issues.
Yeah. Like Renee said before me, their work is so important. If they aren't doing what they're doing, I honestly do not know where we'd be today, where my children would be, you know, what the future of their health would be. It's just, this work is so important for so many reasons.
Okay, so we might invite you both back up, and also Renee for the panel discussion. So I've got some questions. Did you want to all come up with? Unfortunately, we've only got 2 microphones, so we're going to need to just share them. Linda, you sit wherever you're comfortable. So if you have any questions in the audience, I'll just ask a few, but raise your hand and we'll get around to as many of your questions as possible. I thought we might just delve a little bit deeper into the position statement, and because it's there's a lot in it, and I do encourage you to read the position statement. I thought we might start with you, Michael. It talks about there's an urgent need for evidence-based strategies to prevent CTE, particularly children and adolescents, and the RCPA wants to develop prevention risk minimisation protocols for all contact and combat sports, including, you know, potentially restriction on kids under 14. What should that look like, and why is that so important, just from your point of view?
I guess, as I said before, the issue of CTE is not the same issue of concussion. And while I think all the codes have really been concentrating on tightening up concussion protocols and moving that area forward, but that's not going to be particularly effective in addressing the risk of CTE. As I said before, it's the hundreds and hundreds of non-concussive impacts that seem to be the driving the risk of CTE. And certainly we know from studies from American football players that the 2 fundamental principles in any CTE minimisation policy need to be reducing a person's cumulative lifetime exposure to these head impacts, as well as increasing the age of first exposure. And those are the 2 fundamental principles that every code, I think, should take on board and work out how to modify their game for younger people.
Jump in for trivia, Shane never ever got taken from the field concussed. His was exactly what Mike was speaking of. It was never a concussion issue per se.
That is really, really fascinating. So if sporting codes are saying, oh, we've got a concussion policy, then that's a great example to show that it's not concussion that's the issue.
And it's not just someone impacting the head. Oh, I don't really need it.
It's also, Shane was a hard ball getter, so he would get an elbow and a boot and another knee and then race up the field and jump in another pack and get, you know, so that is exactly what happened to him. So I just thought I'd back you on that in case you needed some professional support there, Michael.
But that, I mean, that's a great example of where the lived experience actually backs up what the research and the science is saying. So it's amazing to have that. I mean, one thing I am interested in, and Michael or Linda jump in, we don't really know what the incidence of CTE is, do we? And so I'm wondering, Michael, can you share what your research so far has found with the brains you have examined in terms of the incidence? And then maybe Linda, what you think in terms of how common it could be?
You're right.
Nice loud voice.
Because we have to diagnose it at autopsy, it's very hard to do large, population-based studies to get good statistics on incidence and prevalence. Certainly so far, I mean, we've almost got 100 brains now, and I think we've issued reports on just over 70 of them, and we're still sitting at a 50% diagnosis rate of CTE. So in this cohort, this is obviously a selected cohort. They're people that are concerned about, or their families are concerned that their loved one might have had CTE. So, but in that selected cohort, it's the most common it's the most common disease we're seeing. It's more common than Alzheimer's disease or any other disease. So, and at this stage, we're seeing the numbers now are such that we've got more diagnoses in amateur players than we have in professional players. So we don't yet know how common it is. We hope that it's not very common, but I think the jury's still out.
And I just wanted to pick you up on that bit about more diagnosis in the amateur than the professional. Would that indicate that maybe there are fewer safety protocols with the amateurs, and that maybe the professional codes are? Why do you think that might be, basically? I mean, an analogy I could think of, I did a story about the impacts of bushfire smoke, and it was particularly looking at the difference between volunteer firefighters versus paid ones. The paid ones had the proper equipment, whereas volunteer people didn't have the proper equipment, and so they were actually showing up higher rates of the cancers related to bushfire smoke. So it's just interesting, because they didn't have the proper equipment. I'm wondering whether there's anything that could lead amateurs to have that risk or the greater incidence.
Well, there's certainly, I mean, there's a lot more people playing at the amateur level than the professional level, so it could well just be that there's a much larger pool. I mean, anecdotally, I've heard that there may not be such strict controls in the amateur games, but I get very nervous when you ask me a question about sports, because I'm not an expert in that area at all.
No, but it's interesting. And Linda, what I might just, in terms of the incidence, what do you think, based on what you've seen, in terms of how common it might be?
I think it's really difficult, and we don't know.
Don't know.
And the reason we don't know is that we just aren't able to do the extensive examinations. Particularly, deaths by suicide, there's, around 15 per week in Victoria, and the rates are similar around the country. So it's just not possible to do the brain examinations, given that volume, to understand the incidence and how it might be impacting people. And so that's why I think pathology in this area is so important, because it's the first step to developing some diagnostic tools in life, because I think once we have those, I think we'll have a better understanding. So as Michael's indicated, yes, we're looking at a highly selected population here. But I think that's what's really important about this research, is that it can be translated to something that has greater utility across the population, and it can intervene before people come to me.
Yeah, so what could that look like? I might ask you, and then maybe Michael, what could it look like to have a diagnostic tool for people while they're still alive to see whether they might have CTE?
Well, in terms of treatment, I mean, clearly treatment of neurodegenerative diseases is a difficult area, challenging. I think it will have high value in the prevention space. Then we'll understand more about the types of impacts, and is it just confined to contact sport? Is it broader than that? They're the things that we really need to understand. So I guess my perspective is that a diagnostic marker in life will give us a lot more understanding of the condition and how we can prevent it.
I might just ask Michael that as well. So is that ultimately the goal, to have something that you could identify? I mean, obviously prevention is the number one thing to prevent this happening, but also having some way of diagnosing people and potentially treating them so they don't end up having the severe disease.
Just before I get on to that,
yeah, sure.
I just want to correct Linda here. We could cope with that number of brains if we had federal government funding.
That was one of my questions. Yes, what
So-
difference would it make? That's one of the call to actions is the RCPA wants governments to allocate more funding for medical autopsies. So
Yes.
what difference would that make, do you think, to making sure that we can get a better understanding of how common this is?
Look, I think at this stage it's really important. Certainly even over my career, the medical autopsy has shriveled away to almost, zero cases. And that's because it's not on Medicare. So there's no mechanism to fund it. So I think that's a very urgent issue, and because who knows what else we're missing. So I think that is actually really important. But to get back to your question, it was how we can die. I think it is very important.
Yes.
A diagnostic test during life will be critical, and certainly that's part of the ongoing gift of all the families in this room today that have donated, because that tissue is now being used to power research into, not just by us, but by others, into developing diagnostics and into trying to work out how to even effective treatments. I mean, we're a long way from that, but the tissue, the gift continues to give back to society. So we're incredibly grateful for what everyone's done. And I think we're very lucky to work with a group at University of Sydney who's just taken on a PhD student to address that very issue. So
Fantastic.
we're very excited about that. And she may be in the room today, I'm not sure. But yes.
Have a wave. Well, stand up, whoever our PhD student. Yeah, what was her name?
That's Joanna.
Joanna. Give Joanna a round of applause. Give Joanna a round of applause. I'm looking forward to reading that PhD thesis. And I just want to stick for a minute on the issue of, and this is also part of the position statement as well, it calls for the inclusion of traumatic brain injury and contact sport history to be included in things like standard medical taking, when someone's taking a medical history, and particularly in general practice, neurology, psychiatry and forensic medicine. What sort of difference would that make, Michael, if GPs were asking about people's history of playing contact sports as a standard sort of medical history thing?
Linda may have better thoughts on that than me. I just think, well, one, then it's on every doctor's radar when someone presents either with mental health issues or behavioural or cognitive issues. It's on their radar. Also, I mean, certainly when I went through medical school, we were taught this is your standard history, and part of the history was alcohol use, cigarette smoking, and I think we need to add in exposure to contact sports. But Linda probably has something better to say.
We're very important up here.
Did you see that? Yeah. Ask you what you think about this.
Thank you.
I think I'd reiterate in terms of someone's medical history whilst they're alive. I think that is very important because as autopsy pathologists, we have access to that information. In the sort of the hyperacute phase after someone's died, not every family is receptive to have conversations around precipitants in terms of death via suicide. So it is a very difficult issue to be specifically probative in some families who don't really want to talk about it. In fact, in our family health program, in terms of, for example, sudden unexpected death in epilepsy and sudden cardiac deaths, we have a number of families who want to talk but not right now. So that's why if it's in their medical history, that gives us...
Be really helpful. Yeah, if it's something that's already listed that you can see, oh, there's a history here, it was taken by their GP, it was taken by their psychiatrist, by their neurologist, it says here that they had a history of contact sport. It means it's not up to families to have to raise it as an issue.
Although, as I mentioned before, when families have an awareness, our experience is they do raise it when we have conversations with them, and that is really valuable for us.
Well, I might just get Renee and Amanda to talk about that point about the importance of having this in people's medical history. So their standard medical history, just not necessarily waiting for something to go wrong, but having a history of contact sport.
Yeah, for me, there's two parts of that. I must admit, a day doesn't go by that I don't wish that I knew back then what I now know about CTE. So from that perspective, if we'd known, Paul had presented to the club doctor and he had given us a heads up, I could have supported him so much more. Like I said, I just put it down to the pressure I was working in. Secondly, to not have those answers, like I know our case, I suppose, was a high-profile case. So Professor Buckland reached out, but if we weren't in the environment we're in, we would never have got that opportunity. So there might get those answers.
There's potentially lots of other people who have been in the same circumstance who haven't got that opportunity.
It breaks my heart to think that there may be a family out there who went through what we went through and don't have the answers. Like how do they ever move on? So it's so important for a number of reasons. And Renee, what do you think about it?
I just absolutely entirely agree with Amanda on that.
You don't need this, do you?
No, not really. Sorry, I lost a bit of a train.
No, that's fine. Just we're talking about the importance of including contact sport in routine medical history.
Well, yeah,
so
of
not
course.
necessarily
It
waiting
wasn't
for
Shane's job to diagnose himself on the field as to not come on or off. Whether or not that's not a blame or an attack. Yeah. That is saying he was an athlete who suffered a cumulative, not knocks, impacts to the head day in, day out when he played. Now, if that was on his medical, etc., and we were not a profile case, Shane would have gone down with that brain, the worst one in Australia that Michael has seen, and no one would have known. But if there is I'm all about that. I don't know how that doesn't make any sense. It's free, it's simple. I know that you speak of families that get quite funny about, discussing things in their grief too. So that makes perfect sense. So that's a yes from me.
Okay. So we might, if the audience has any questions, I can keep asking questions for the whole thing, but I'd really love to hear your questions. And I'm sure the panel would love to hear if you have any particular questions for the panel. Just raise your hand and I don't know if we've got any extra microphones, but if you've got a loud voice. Anyone have anything they particularly want to ask? Otherwise, I'll keep asking questions. Yes? Thank you.
Are you seeing it in female athletes?
So the question is, are you seeing it in female athletes, Michael? And if so, how common? Is there any sign it's showing up more in men or women?
We've only actually examined a few female brains so far, and we have found it in one female player that was the late Heather Anderson, whose family were incredibly generous and understanding in donating her brain. It does worry me seeing just the surge in popularity in female contact sports. And we know there is a lag time between exposure and onset of disease. So I would expect we will be seeing more. And I have said in the past, I'm sort of hopeful that I think in general women are more sensible about their health than men. So if there are female professional codes, it may well be that they're the ones that are going to lead the change. But yes.
Yeah, but it's a worry where we'll go before that happens.
Yeah. And I guess that's the point, isn't it? That we can't really necessarily wait for it to be a top-down approach. So maybe
injuries, it's deaths.
Yeah. Did you want to talk about that? About the fact that we can't necessarily just wait until the codes, for example, decide to put in protocols and things?
Well, I just think I've never played football and I'm all about equality. It doesn't come down to a feminist movement, but I worry when I watch women play at how hard they are hitting each other, because I know how hard Shane was for a big, strong fellow to be hitting, whether it be the ball, people's heads, whatever. It makes me cringe when I watch it. It really makes me worry. And then you see that vague look. My youngest brother, Travis, got quite a big head impact when he was playing just your amateur suburban football. It rattled him because he knew what we'd been through, what my parents had been through and what Shane had been through. And he role modelled by taking good 4 weeks off, and he didn't even know if that was long enough. But no one's there to direct, and he's not his own doctor. I don't know where I went with all that, but
No, I think the point we were making is we can't necessarily wait until people, say, running the sporting codes, make the changes. It's got to be a bottom-up approach, and I think that's what Michael was saying.
I want it to get worse before it gets better, I guess is what I'm saying.
And what do you think,
I was just going to say, from my perspective, it does worry me because there is such a big push and drive for women in these non-traditional sports that women now play. It's big business. You know, these big sporting bodies can see the revenue that can be driven from this market. So it does worry me, and I see the programs now going through schools, like, you know, AFL are rolling out a program through the female schools, and you know, I've got a daughter who's so keen to play, and so it is a worry. We just need to get on top of it, and like I've said all along, just make sure the environment is as safe as possible for these young ladies.
And I'm wondering, just sort of reflecting on what Australia grappling with this, Michael, are there any countries around the world that have tackled this, not as a joke, have tackled this issue, pun intended, successfully, that we could look to say, well, this country has got a great policy on CTE, or this country is much more proactive on dealing with this, that we could look to maybe emulate some of what they're doing? Sorry.
Look, there has been at least states, like in the US, I know some states have stopped children heading the ball in soccer.
Soccer, right.
And that's through legislative changes. And I think also there's also a minimum age for body checking in ice hockey. There may well be other examples which I'm not aware of, but there are efforts internationally to do this.
What was that one?
Flag football.
Yes, there's a big push for flag football, you know, the non-contact versions.
All right, non-contact gridiron. Is there a gridiron?
Yes, yes.
Right.
Yes.
So they're not, but non-contact version of it.
Yes, there is a push to try and bring that in as well, like compulsory. I don't think they've got there yet, but there is activity in a variety in the UK, the US, Canada, and yeah, Australia needs to pull its finger out.
Bottom line, really.
And are we just, if anyone else has any questions, raise your hand. Anyone ask any? Yep, Laurie's got one, and then we'll go over here. Laurie, yeah.
I was just going to ask Michael about commenting on the relationship between practice and the game. From some of the papers I've read, it's that practice is actually the greatest danger. Yeah.
You mean training?
Well, training, yeah, training, yeah.
Practicing of the game, training, yes.
I have read some things that there are more sort of undiagnosed concussions during practice. I'm not an expert on that, but certainly that would be the obvious way to reduce someone's cumulative exposure without even changing the game on game day, by reducing impacts during practice sessions. And Laurie, actually, I think you're right. I think, from my understanding, it was the American football, NFL, it was the players' union that was strong enough to stand up and say, okay, we are not allowing our members to have more than, say, 15 minutes full contact training per week.
It's the rugby English.
Rugby.
It's the English rugby union.
Oh, we're hearing, so it's the English Rugby Union that put that into practice. So it's obviously internationally becoming a big issue,
Yes.
isn't it?
Yes.
Yes?
Excuse me, I played a bit of football, and we used to have match practice and had to bring the mouth guards, and say every Tuesday night we had physical contact for about half an hour. So you're not just playing the Saturdays, Tuesdays and Thursdays, you can still get knocked around, as you said.
So that's, yeah, it's not just what happens on the game day. That's a really good point. So we've got a question. Did you? Yep.
My name's Wendy Howell. Just a question to you, Michael. I've got here the expert evidence of a US scientist who's part of the NRL's research group for their, I think it's called the Retired Rugby League Players Brain Health Project. Anyway, this is an expert statement he provided to a US Supreme Court case in which he's challenging the diagnostic criteria for CTE. And he's saying that according to the, I think it's the NNDIS criteria, Is that right?
NINDS criteria, yep.
Yeah, that's the one that you use to diagnose CTE. He's criticising it, and he says here, the reader should understand that the so-called pathognomic lesion could be as scant as a few cells or structures, visible only microscopically, that turn brown with the application of reagents, and that such a low threshold does not exist in neurodegenerative disease diagnosis. So it is not at all clear why the consensus group endorsed this low threshold, or whether there was any scientific basis for this threshold. What do you say to someone who's a so-called expert, retained by the second richest collision sport in the country, who's attacking the very basis of what you're doing?
Well, yes. So the consensus diagnostic criteria was endorsed by the NIH, National Institutes of Health, and the NINDS, and it was generated by a whole group of leaders in their field of neurodegeneration, and they all agreed. So I guess often when there's changes, you often get an outlier that doesn't like the changes, but that's why it's called a consensus statement, because it's a large number of expert neuropathologists from internationally all agreeing that this is what it looks like and this is what it happens. So it's hard to, there's always going to be an outlier or two.
Does it worry you that the NRL's retaining experts who say things like that?
We'd love to. Very happy to talk to the NRL anytime. And
I think you need to follow the money. You need to follow the money and think, why would an expert be saying that? Because they're being paid by a sporting body because it supports that view. So I think and it goes to what we were talking about with the bottom-up approach rather than waiting for the top-down. If we're going to wait for the top-down for sporting codes to change, there's so much money tied up in maintaining the status quo. Why would they want to adopt these issues and take these issues seriously? I can say stuff like that now. I don't work for the ABC. Sorry.
Yes.
I was just thinking, oh shit. But I can say that now because, part of my role when I was an investigative journalist was following the money, following who's being paid to say certain things. People are retained as experts by big business, by big sporting codes for a reason, because they know that they're going to say something that's favourable to that organisation. So, and I think it does dilute it definitely dilutes their independence if they're being retained by a big sporting code.
I also think that's the reason why this statement today by, the Royal College of Pathologists of Australasia, it's not even just Australia, it's Australia, New Zealand, Malaysia and Hong Kong and Singapore, this statement has gone through multiple advisory committees that have all approved it. So it is a collective expression of the pathologists' considered opinion on this issue. So it's hard having one outlier say some different things. It's a bit hard to argue when you have such a prestigious medical college endorsing this position.
So we're almost running out of time. Any questions from the audience before I go around to the panel to get our sort of final statements? Any other questions? Yep. Thank you.
Michael, if I'm interested in donating my brain, how do I get involved?
So
I'd keep it for the short term though.
You just got to go to brainbank.org.au and there's a button on the homepage that you can register your interest to donate your brain.
So do you accept healthy brains as well, or just people that have played sport, or?
Oh, look, we accept essentially all brains from anyone that wants to donate, that's played any sport at any level for any period of time. And it's really the non-contact sports players, say a tennis player or a swimmer, they're just as important because we need to look at brains with and without exposure. So
In saying that, I've donated mine, and Travis, my youngest brother, is thinking about it because that might help a genetic family thing too. That's all your forte. However, it's just all things to start to think about. Dad said to me, "Oh, that's if they find one, Renee." He's hoping.
Oh, that's so great. So look, I might just get all of the panelists to go around and just sort of give us a little a key message that you want the audience to take away. We've covered a lot of ground today. It's been an amazing discussion. But Michael, we'll start with you. What do you really want this audience to take away from our debate today?
I guess, as many pathologists probably already know, it's easy when you're working in a lab or just looking down a microscope. Don't ever forget that there's a person behind that and there's a family behind that person as well. And that, I think, really informs, I don't think I actually have to say that because most pathologists understand that, and that really informs their practice.
Fantastic. Amanda, what would you like the audience to take away?
I suppose for me, I honestly cannot thank Professor Michael Buckland and the Australian Sports Bank enough for what they've done for my family. And what they're doing for my children moving forward. This is just so incredibly important for the next generation. So thank you.
Thanks. And Renee?
Totally agree with Amanda. And in follow-up, I'm sure you all know that it is someone connected to your study you're doing, but do not stop. If you believe in this and you believe in what you do, you are saving not only, I was going to say their lives, but they're already gone. But you're helping them, you're making sense of what they've suffered. And there's a big suffering story prior to where they're at in front of your microscope. And that leaves trauma and really bad memories. But ours are helped by, and as Amanda said too, the diagnosis. Shane's kids will go on now knowing that he had a serious issue with his brain. So mine is thank you. Thank you from the bottom of my heart, from my family and my future niece and nephew when they get older, and please just believe in what you do and go for it.
Thank you. And Linda?
Two things, I guess. Firstly, I just want to reiterate how thankful we are to families such as yours for the gift that you've given that enable us to do this work, because it's vitally important. And lastly, I think, and perhaps tangentially in terms of your comment, I think fundamentally, if you love sport and if you love the people who play it, then you need to be part of the solution, not perpetuate the problem and kick the can down the road.
Yes, exactly. Give them a round of applause to everybody. Thank you so much. I'd now like to introduce our President, RCPA President Laurie, to say a few words. Laurie Bott, well, you guys can come and sit down. Right. Thank you.
Yeah. Thank you so much, though. Do you want this back?
Might be safer.
Yeah, thanks, Sophie. Yes, well, thank you everyone for attending today. It's been a really extraordinary day and incredible discussion. And so it's my role to present the position statement, but I also wanted to just say a few things myself. Well, the first thing is to thank our speakers. I mean, I think that their discussion was very open and clear, and if we're going to advance this issue in our community, this discussion has to be at this level, and everyone's got to be very open and honest. I don't look like it now, but I actually played first grade rugby in my early 20s. I was a fullback. They didn't often lay their hands on me, but anyway. But I dislocated my shoulder at a badly once, retired, and long story. But it possibly saved me from CTE. Who knows, if you know what I mean? So, but I also understand that passion and, the positive things about, all these sports that we're talking about, it's not easy. It's not easy what we're dealing with, so I understand that. We'll uncover much more evidence about CTE in the future. There's no doubt about it, but we know a lot now. We know an awful lot. Now, I really personally worry about, as we've heard here, you know, what we are exposing our kids to at the moment. You know, we're just getting this early bit of the knowledge, but, you know, young girls and boys, you know, young men and women, you know, we potentially are in a situation where they are damaging their brains and, you know, they'll suffer, as we've heard. And I must say, you know, I think everyone in this room probably felt the emotion when you were speaking, Renee and Amanda, of the photos of those people, those young men, really, and it would be happening to young women. So, and the loved ones, I just add that too, not to forget the families, you know, it's quite, you know, it's an incredibly emotional thing. And we are our brains. We are our brains, that's what we are. So CTE is preventable, we've heard it said before. Yes, we need more evidence, as I said before, but we have a lot. And I'll just say CTE highlights the important role of pathology in providing these answers. You know, we're able to provide the answers for the families, and so the pathology's role is so important in diagnosis, disease surveillance, and underpinning all these preventative strategies. And I truly understand in the midst of the tragedy how pathology can provide those answers and be such a relief for the families and explaining things. It's such, must be so important. And as you've said, some of the families never actually have had that. So the college has created a 5-point plan. You can see it there. I mean, the thrust of it is that we want the disease to be diagnosed appropriately. We want a lot more research into CTE, and we want to develop our diagnosis of the disease and have a much better understanding of it. And we want to put in place some preventative protocols and strategies, which I think clearly we believe as a college there's enough evidence there to put these things in place, and we have to elevate the understanding of this disease to the community as a whole, and particularly the administrators of the game. So our 5-point plan here, a lot more detail than I'm going to say up on the board, but so the college, the RCPA, calls for the development of CTE prevention and risk minimisation protocols for all contact sports. So there's obviously an urgent need for evidence-based strategies to prevent CTE, particularly with children and adolescents. So a CTE prevention protocol has recently been released by a global coalition of CTE experts, and this outlines the simple measures that can be taken to reduce CTE risk, reducing the cumulative exposure to head injury. So the preventative protocols should consider the maturity of the brain, and the RCPA recommends that low or no contact versions of the sports are played by those under the age of 14, as controversial as that is. Number 2, and I know we've heard it discussed before, but the RCPA calls for all health and medical services, including state and territory forensic services, to identify pathways for autopsy brain examination for deaths where the family raises concerns of CTE. So the college, number 3, the college advocates for the inclusion of a traumatic brain injury and contact sports history in the standard medical history taking in general practice, neurology, psychiatry, forensic medicine, and other specialties. Number 4, funding. The RCP requests the Commonwealth and state and territory governments to explore how better funding of medical autopsies, including autopsy, brain examination and CTE. Number 5, the College asks governments to follow recommendations from the recent Senate inquiry into concussions and repeated head trauma in contact sports. So again, I'd like to thank you all for coming today and showing your interest in this important topic. I'd like to thank Sophie for hosting. Thank you. Particular thanks goes to Michael Buckland and Linda Iles for their presentations and their expertise and their work in the field. Congratulations to you. It's so valuable. And thank you to Renee and Amanda. It's just, as I said, so wonderful to have you here. You've had, you know, it takes a lot of bravery in the midst of the tragedy you and your family have been to stand up and say these things. So, but so helpful for the future health of people involved in these sports. So big thank you to you. So thank you. And I'd like to finish by just stating that the College explicitly endorses the committee view from the 2023 Senate inquiry, and I quote, "There is clear evidence of a causal link between repeated head trauma and concussions and subsequent neurodegenerative diseases such as CTE. Whilst important research questions remain regarding the degree of causation and the nature of long-term impacts, these questions should not be used to undermine the fundamental nature of that link. As is clearly known, CTE is a preventable disease." Thank you, everyone. Thank you for coming, and back to you, Sophie. Cheers.
Thank you, Laurie. Look, I just wanted to say thank you, everyone, for being here. Today's discussion's been really fantastic, really enlightening. I wanted to, and I hope everyone now, if you didn't before, really understand the importance of CTE and how pathologists really have such a crucial role to play in this important public health discussion to protect children in particular from injury. I want to again also reiterate what Laurie said, particularly thank our families for being here today, Renee and Amanda. We know it must not always, even though you're doing a great job, it must not always be easy to have to relive what you went through, but we just so appreciate you being here to share your message because it amplifies everything that the pathologists are trying to do. So thank you for being here. Thank you everyone for being here and watching online as well. If you're here in person, please join us now for refreshments. Thank you very much.